So before I get started, I don't have anything to disclose on the materials that is being used in this presentation. Now, for the next 15 minutes, I just have three main objectives. And the first of that is to review the lifestyle-related diseases prevalence. And then let's discuss evidences of nutrition-related approach to chronic disease management. And then, of course, I wanted to introduce to you lifestyle medicine as primary care approach for chronic diseases. Let me start it this way. I'm sure you're familiar with Dr. Dennis Burkitt. Now, he was called the fiber man because of the research that he was able to conduct and the findings that he had when he was working in Africa. Now, he said the concept that modern killer diseases are lifestyle related and therefore potentially preventable and reversible is the most important medical discovery of the 20th century. Now, this is one of the slides that is one of my favorite. Now, look at this. These are the top five cause of death worldwide. And as you will notice, all of these are lifestyle related. Now, looking at these types of diseases, it's the same diseases that is now listed as a comorbid or pre-existing condition that increases the chances of fatality in case we get infected with the current pandemic caused by COVID-19. So practically, you will really see here with the reports that we are seeing every single day, at least with the report of the CDC, you can find here that whenever you have heart disease, diabetes, chronic disease, high blood pressure, cancer, the chances of fatality is higher. But we have a good news here because as long as you don't have these types of chronic diseases and you're able to control your conditions, chances are less than 1% of fatality. So the good news here is that we can always do something to improve our health outcome because these are lifestyle related. So that means you have certain control, with your lifestyle. So practically what we are facing right now, in fact, is COVID-19 pandemic, and this is amid the long-standing global non-communicable disease epidemic. Now, looking at the statistics that we have in our first objective, looking at the prevalence of these types of chronic diseases, you will see that 1 in every 4 Filipinos are already hypertensive. Unfortunately, more than half of these 12 million Filipinos who are affected of hypertension are not totally aware that they are hypertensive. And then 1 in every 5 Filipinos are already pre-diabetic or already diabetic. So that's a huge number or a huge percentage that actually they are projecting that the prevalence will come up to about 7.8% by 2025. Now, my question here is who is affected? Now, basically, looking at the situation right now, if you visit the hospital and if you look at the patients that are coming in the clinic for chronic care, you will realize that the degenerative disease is now affecting every single person, both young and old. So we usually believe that these types of diseases are degenerative. It goes with age, but not anymore because young people are already affected basically because of the faulty lifestyle. So basically now, as you can see, the chronological age is not anymore compatible with the biological age. So that means chronologically, that is the actual age that you have based on your birth certificate. That could not be equivalent to the age of your cells right now or the age of your organs right now. Because, like for example, a 32-year-old is now taking maintenance medication for hypertension, for cholesterol, and taking medications for diabetes, right? That's not expected of a 32-year-old. Okay, so the youngest diabetic patient I had was 11 years old. Fortunately, we were able to reverse it. Initially, we thought it's juvenile, but it's acquired diabetes. Basically, these types of diseases are affecting both young and old. Now, looking at the research that I will be showing you right now, you will see here that low blood pressure are actually noted among people who are eating mostly plant-based. Now here, looking at this graph here in this table of presentation, this figure will show you that those who are at the strict vegetarian diet, they have the lowest blood pressure, in fact. Now, if you look at this in pre-industrialized communities, and yes, they are existing, who are consuming less than 500 milligrams of salt per day, there is a total absence of hypertension. And this is to compare with industrialized country dwellers like us who are consuming about 3,000 to 5,000 milligrams of salt. And I'm not really sure if we are really able to count the salt intake that we have every single day, especially if you always eat out and we eat processed food. Unfortunately, you will lose tracking, of the salt that you take every single day. And you will find out that hypertension is one of the top killer diseases. Now, I wanted to introduce you that the 5 original blue zones in the world. So these are areas where centenarians are present. I mean, people living over 100 years old, living healthy and functional. This is what you call longevity. You live long and then functional, are found in these areas in the world. So one of those is Sardinia, Italy, and then we have Loma Linda, California, and then we have Okinawa, Japan. I would like to introduce to you Loma Linda, California. This is the Adventist cohort because they are practically living in an industrialized community because the rest of the blue zones are living in isolated places. Now here, the Seventh-day Adventist cohorts in Loma Linda were practically living in an urbanized area, but they were relatively able to preserve their health because of the lifestyle that they have. Now, they were able to find out in this research that 48% of the Seventh-day Adventists are non-vegetarian. So that means they eat anything. They eat meat, fish, so on and so forth. Although there are some types of food that Seventh-day Adventists are avoiding. And then 6% of them are semi-vegetarian. 10% of them are pesco-vegetarian. That means they eat fish, egg, and then they eat dairy, but mostly vegetables. And then 28% of them are lacto-ovo-vegetarian. That means they eat mostly vegetables. They don't take meat, but they include eggs and dairy in their diet. And then only 8% of them are total vegetarian. So what am I trying to point out here is the result of the risk factors in terms of developing chronic diseases and the health outcome. Now, this research were able to find out because there are a series of researches that was conducted with Adventist. There was Adventist Health 1 study and then Adventist Health 2 study, and they were able to find out that those who are vegetarians are carrying less weight for men and then both for women. And then looking at the risk here, it looks like it's dose dependent, right? The more you get into more plant-based diet, like for semi-vegetarian, those who are pesco-vegetarian, lacto-ovo, and then those who are vegan, you will see here that the more you get into plant-based diet, the lesser the chances and the prevalence of diabetes and hypertension, and of course the BMI. Okay, now I know you're familiar with Dr. William Roberts. So he was once the editor-in-chief of the American Journal of Cardiology. He is convinced that the disease, which is atherosclerotic disease, has a single cause, namely cholesterol, and that the other so-called atherosclerotic risk factors are only contributory at most. Now, he was able to publish this at the Journal of College of Cardiology. Now, he was able to find out here that cholesterol is really something to do with the presence of atherosclerosis. And remember, in the United States, heart disease is the #1 killer, and so in the Philippines. Now, he is in this study again. This is another study that was conducted. They are emphasizing here that the moment we achieve a level of LDL which is less than 70, take note, this is less than 70 milligrams per DL. Now, if you remember, the normal level for LDL is up to 150. Sometimes we're happy that the level of LDL of our patients is 100, but unfortunately, in this research, it is showing that there is a regression line that suggests that there is atherosclerotic reversal. Those plaques are melting whenever you maintain a level of LDL which is below 70 milligrams per DL. Now, this is the basis of the treatment that is being used by many of the researchers that we already have right now in lifestyle medicine, particularly Dr. Dean Ornish, in his program, which is subsidized by the American Medicare, right? Now, another commentary here that was published by Dr. William Roberts, they are really talking about your ideal LDL cholesterol should be less than 70 milligrams per DL. But how will you be able to achieve such low level of LDL if our everyday consumption is cholesterol laden? Like, for example, if you consume 100 grams of shrimp, these are crustaceans, they have higher cholesterol level compared to that of chicken. Okay, so these are just one of the guide, one of the examples that we have to remember and we have to put in mind. Now, I'd like to introduce to you Dr. Caldwell Esselstyn, because he is one of those researchers who was able to reverse atherosclerotic condition of the heart, the coronary arteries, basically by using plant-based nutrition. Now you see these are patients who are called the walking dead. Why they're called the walking dead? Because they are not good candidates for bypass operation, so they had no choice. And so these patients were placed to plant-based diet, intensive therapeutic lifestyle program, and after several months, if you can see here, this is 32 months in the study, others are 60 months in the study, there was a clear and significant reversal of the narrowed artery. Now, again, this is Dr. Dean Ornish, who does the same research using foods from plants that have no cholesterol and no animal fat. And then there they see signs of reversal were clear and evident in 82% of their patients within 12 months alone. So this is one of the bases that we use now in lifestyle medicine. So this was published in the Lifestyle Heart Trial, proving that intensive lifestyle changes for reversal of coronary heart disease is possible. So this has been published at the Journal of American Medical Association for several times. Going back to the Philippines now, you will see here that over 200 Filipinos are dying of heart disease every single day. So that's the number one killer in the Philippines too. And the CDC is telling us that that's number one among the risk factor of dying from COVID-19 whenever you have heart disease, right? And even the World Health Organization is telling us that if you have this non-communicable disease condition, all you have to do is to change your lifestyle. One good thing here is that these are modifiable. That's a good news because these are lifestyle diseases basically caused by lifestyle related behaviors, and so therefore it is modifiable, right? So one of those is taking of unhealthy diets. For example, that's why right now there is what we call the food-based dietary patterns and chronic disease prevention that is being utilized in many different spaces in healthcare and in education. So my question here is that, is it really coronary disease, or is it a culinary disease, basing on the evidences that we showed you earlier? So basically, this is one good news because there is already a practice that is what we call culinary medicine. This is an evidence-based field of medicine that blends the art of food and cooking, okay, and the science, food cooking or food preparation with the science of medicine. Basically, the goal here is to educate patients and healthcare providers on nutrition, cooking skills, and of course, healthy behavior, talking about what we eat, how we prepare them, what do we do, what we put in it, why do we have such preferences, and how do we deal with unhealthy cravings. So basically, culinary medicine or nutrition prescription is one of the competencies that we use in lifestyle medicine. Okay, so in 2010, the practice of lifestyle medicine officially came out, and one of the modalities that we use is culinary medicine. So basically, lifestyle medicine is the use of lifestyle intervention in the treatment and management of disease. And as you can see, these are the modalities that we use in lifestyle medicine. Basically, nutrition, physical activity, stress management, and sleep. They cover most of the intervention that we use in lifestyle medicine. Nutrition covers approximately 60% or more of the intervention that we provide whenever we see patients in our clinic. So that's how important it is that we use this RX sign in many different ways. Like, for example, we may provide this type of prescription to a patient with diabetes, but we make sure that we also provide this type of prescription to our patient. For example, literally prescribing leafy green vegetables 1 to 2 cups in each meal for 30 days. So this is intentionally prescribing nutrition to patient, and then prescribing exercise to patients, so on and so forth. Now you will notice here unfortunately, that the success of providing education to patient really depends on the physician's knowledge and the physician's attitude and your practices. That's why the goal here is to educate physicians as well, and not only the patients, because the moment we encourage physicians, we motivate physicians for them to live healthy themselves, most probably they will share this to their patient. Now I'd like to ask you here, in the wellness continuum model, where are you at right now? Okay, so when we say wellness, it's a continuous process of maintaining your health. If you're not doing anything to maintain your health, you're not going to achieve optimal health, right? So basically, what we're doing right now is awareness and then education, and we have to grow using those educational tools and materials for us to achieve wellness. Otherwise, we will start developing signs, developing symptoms, and eventually develop disability and illness. So I'd like to thank you so much for giving me this 15 minutes of introducing to you plant-based wellness. Thank you so much.